Each one of us is unique. We have different skin colors, hair colors, body shapes and sizes, but we all look alike inside. More than 200 bones, 600 muscles, a maze of tissue, ligaments, and cells. Our human anatomy, with all its complexities, remains one of the greatest territories for exploration.
Imagine having to travel hours just to see a doctor for even the most routine health care. For the millions of people who live in the nation's rural communities, it is not something they have to imagine, but an ongoing crisis every day. Because of a severe shortage of physicians, many rural areas are now medically underserved, and nowhere is the situation more critical than throughout eastern Kentucky and the Appalachians.
According to a report by the Kentucky Institute of Medicine, Kentucky is already experiencing a shortage of over 2,000 physicians. The problem is particularly acute in the rural areas of the state, which are also the areas that have the highest rates of chronic disease. The neighboring Appalachian states are experiencing a similar problem, and it's only expected to get worse over the next decade.
We have people with clogged arteries in their hearts and in their brains, which cause stroke and heart attack. We have individuals with chronic lung disease. We have children with learning disabilities. All of these things add to the urgency to get medical care into this region.
Attracting and retaining doctors to this area has been a serious challenge for years. The Appalachian region has the fewest number of primary care doctors available, along with a large population who are poverty-stricken and suffer from the most severe health problems in the country. With the nation's growing awareness of family health care and the region's desperate need for family doctors, osteopathic medicine is proving to be a vital part of a promising future for everyone's medical needs.
As osteopathic physicians, we're unique, I believe, in the fact that when we address an individual, we look at the patient as a whole. We look and we see the individual as a unit that includes the musculoskeletal system. That is your muscles and your bones. It makes up 60 to 65% of our bodies. So why should we ignore that? It has to play a part in your health.
DOs are physicians who are fully trained and licensed to prescribe medication and perform surgery. Along with MDs, doctors of osteopathic medicine are the only two types of complete physicians in the U.S.
Osteopathic physicians practice in all medical and surgical specialties and subspecialties. However, DOs have always had an increased interest in going into primary care specialties such as internal medicine, family practice, and pediatrics.
Doctors of osteopathic medicine see almost 1/5 of the country's patients, making the training and education of more DOs critical to addressing the physician shortage in Appalachia.
Every aspect of the curriculum at the Pikeville College School of Osteopathic Medicine emphasizes primary care and family medicine. Our graduates are well prepared to deliver the highest quality care to their patients. They will establish the kind of close personal relationship with their patients that will help to improve the health not only of their patients but of the communities in which they serve.
The Pikeville College School of Osteopathic Medicine is successfully battling the nation's rural healthcare crisis by offering a 4-year program that results in the degree of Doctor of Osteopathic Medicine. Many Pikeville graduates go on to practice in parts of the country that are most desperately in need of osteopathic medicine's approach to healthcare.
Pikeville College School of Osteopathic Medicine is unique in the sense that it has a small collegial faculty and small class size that allows our students to mentor with their trainers to master the practice of medicine.
Pikeville College School of Osteopathic Medicine's mission is to produce high-quality osteopathic physicians for rural and underserved areas of East Kentucky and Appalachia. In order to do that, we accept students from rural Kentucky, we train them in rural Kentucky, and they stay here to practice. Since the inception of the school, over 30% of our graduates have located their practices within 90 miles of Pikeville.
Doctors of osteopathic medicine help patients develop attitudes and lifestyles that don't just fight illness, but help prevent it. Millions of Americans prefer this concerned and passionate approach to medical care and have made DOs their doctors for life.
Our students work along with physicians to work with families, see family dynamics, relationships of families and contribution to medical conditions, and truly learn the true DO approach to family medicine.
To make a significant impact on the lives of others who are in need, consider an education at Pikeville College School of Osteopathic Medicine.
Thank you for joining us today on the Profile Series. Be sure to join us next time for more stories on reaching our personal goals. I'm Lou Garza Jr.
For enrollment information, please visit pc.edu.